My name's Joe Johnston. I'm from San Antonio, Texas. My practice consists of abdominal wall reconstruction, which accounts for about 50% of my practice. I have been using Phasix for about 7 or 8 years. I've started using it in the inguinal area first with the plug and patch, and then progressively moved into abdominal wall reconstruction as my mesh of choice. I have every confidence in the world in this product and I don't use anything else as a substitute. This is my go-to product because it works and it does what it's supposed to do. For me, I was doing a considerable amount of abdominal wall reconstruction and using porcine dermis for my reconstruction. And as everyone who does this kind of work is aware, there became some cost issues with how much we were spending on these cases. And when I looked at the data on Phasix compared to porcine dermis, I knew that I had a product that could provide me with at least equivalent, if not better results, certainly at a much reduced cost and a little bit of savings to the hospital and the patient. It's more of a global thing of why it's such a great product, not only for the patients and for me, but also for our hospitals and our insurance providers from a cost perspective. The key thing with Phasix compared to other products, whether it's porcine dermis or synthetic mesh, is the way it incorporates into the abdominal wall. As everyone knows, these operations aren't always a point in time. Sometimes they're a process. In that process, you have to be able to build on the previous operation. And with pure synthetic mesh and sometimes even delaminated biologics, you have to completely redo the original index operation. With Phasix, what I've found and what I've enjoyed is the way that it incorporates into the tissue, and I'll get a good durable repair. So when you think of complex abdominal wound repair, we know that there's a higher recurrence rate without using some type of mesh product. One of the things about Phasix is you can use it both simple and complex cases. From a physician standpoint, using Phasix has been a huge benefit for me. It's easy to handle in the operating room. It doesn't get curled and doesn't delaminate. It sutures in easy. It holds its place well, and it allows me to line up a repair the way that I would want to. From a patient perspective, whether it's in the abdominal wall or in the groin, because that mesh will incorporate into the tissue over time. So really from both sides of the equation, physician and patient, this has been a huge benefit in all of its different forms throughout the years.